My name is Elaine DeMello, and I work with NAMI New Hampshire in the Connect program. And I appreciate the opportunity to talk with you about the Connect program and how it might be part of your efforts to implement RSA 193J and suicide prevention in schools. The Connect program is a comprehensive suicide prevention and postvention program that was developed by NAMI New Hampshire almost 2 decades ago. NAMI New Hampshire is the National Alliance on Mental Illness. It's a grassroots organization established in New Hampshire almost 40 years ago, whose mission is to improve the quality of life for people affected by mental illness and suicide. NAMI New Hampshire began working with the Youth Suicide Prevention Assembly and the Injury Prevention Center through a private foundation almost 20 years ago to develop a comprehensive set of suicide prevention and postvention protocols for youth to apply for all sectors of the community across New Hampshire. The way we did this was we gathered input from a large number of key stakeholders, including representatives from schools, law enforcement, mental health, healthcare providers, social services, faith leaders, families, and youth themselves, just to name a few, to look at how we all come together to try to prevent a youth suicide, or how we work together in the aftermath of a tragedy of a suicide. And this was done to help create a very comprehensive set of protocols with the understanding and the premise that suicide prevention and postvention are public health issues that we can all get involved in. So I give you this background so you have a sense of what the foundation is for the Connect program. The Connect program integrates evidence-based strategies into a comprehensive approach for suicide prevention and postvention to get everybody on the same page so that we can understand our roles and the protocols that prevent suicide and promote healing and reduce risk of contagion after a suicide incident. We recognize how especially important this is with youth, who are a very vulnerable population. The Connect program was originally called the Frameworks program, and it creates a structure for schools, organizations, and communities to work together. A little bit of the evolution from the beginning of the Connect program's development was to look at rolling this out statewide. And early on, we brought together a number of people through different departments in New Hampshire, and we worked with them on those protocols. We trained them in them, and we had representatives from New Hampshire Department of Education, Bureau of Behavioral Health, Division of Child, Youth, and Families, the Division of Juvenile Justice, Department of Corrections, and a number of other social service providers throughout the state to roll out the training and to start to implement it systemically in different organizations and systems in New Hampshire. Since that time, we've trained thousands of people in the Connect program in New Hampshire, and at least 60 schools have been trained in, have had trainers trained and have had youth leaders trained. The Connect program since then has become recognized internationally, and it's been implemented in 5 countries rather, around the world, in addition to the United States, and in over 40 states and tribes. And just looking at that, you'll see a map of where some of the, all the blue areas are where we've had a concentration of working with the Connect program. It's been written up in several journals and publications, including Insights in Public Health, Journey of Community Psychology, Suicide and Life-Threatening Behavior, and the Journal of Rural Mental Health as a comprehensive evidence-informed approach. So some of the goals of the Connect program are putting together a package that includes training, protocols, and consultation for sustaining the confidence of community members, school personnel, and providers in responding to suicide incidents and individuals at risk. When we integrate these evidence-based practices into a suicide systemic approach, we can create a safety net for our community. We use a foundational model, which is the social ecological model, and that allows us to look at the individual who might be the youth at risk and the many factors that might influence that risk or mitigate that risk. But we also want to look at the many things that surround them that we can also have an impact on. So we want to know how to take strategies and interventions that reduce that risk for that young person. But we also want to look at who are the people that surround them. How can we educate them? How can we give them the tools and strategies and skills and the knowledge to know what to do when they are facing someone that they've identified at risk? And then, of course, we want to work with our communities, which includes our schools, organizations, many other foundational parts of our community, our neighborhoods, where we can influence help seeking, reduce stigma, increase confidence, knowledge, and the ability to know what to do when somebody's at risk and have those resources available. And that also extends out to our larger society, which is where we have those protective factors like RSA 193J, things like safe messaging, national strategy for suicide prevention, statewide suicide prevention planning and strategizing, again, to build a safety net and resources that reduce risk, increase help seeking, and mitigate the stigma and other barriers that might prevent somebody from getting help. So we look at this as a model that looks at the individual and says, you know, you're not alone and we're not alone in the work that we do. And there's many different ways that we can influence and support people at risk for suicide or those who've been affected by a loss. So some of the program options, as you see here, in both prevention and postvention, we do training. We can train trainers and we can do strategic planning. We also have suicide prevention training online for just the general public, for healthcare providers, mental health providers, and school personnel. We also have face-to-face and virtual trainings for other components. We've been able to do youth leader training and young adult leader training. And we also have a speakers bureau called Survivor Voices. So there are people who have participated in many different aspects of the Connect program, and there are many different ways to roll it out. The cost of the programs are variable depending on how long the program is and which program option and how many people are participating. So I encourage you to contact us to look at what kinds of packages might be available and how we could help you implement them. We certainly look to grants and other sources of funding to try to reduce, if not eliminate, the cost for schools whenever possible. And then we have several different modules within the program, and some of them get everybody on the same page, and then some are, the third module is usually tailored for the specific part of the community that we're working with, whether it's schools and the protocols for schools or other sectors of the community. But module 1 is recognize, that's for everyone, recognize when you see someone at risk, look at the barriers that prevents people from maybe reaching out to help somebody at risk. The second module is connect with that person and know what to do, what to say, how to intervene with them. And then the third module, which would be tailored for different sectors of the community, including schools, would be what are the protocols to get that person to help within the setting that you're in, and what is your role, and how can you interface with other sectors of the community or within your system to make sure that that person gets the help that they need. The trainings, again, can be available in person and or virtually. They can range anywhere from a couple of hours to a full day training. And again, training of trainers would be a little bit more extensive. That helps people to sustain the program. And our online training is self-paced. It can be a shorter training for 2 hours, or it can be up to 4 hours. And again, the 4-hour training comes with school protocols and a more extensive look at what happens with youth at risk of suicide in a school setting. The staff who conduct the training and consultation are the developers of the program, and we bring decades of experience. As staff at NAMI New Hampshire, we can provide technical assistance and support. We can help schools develop crisis plans or implement protocols and help you in your interface with other sectors of the community and train them as well so that everybody's on the same page. Some of the quantitative and qualitative results that we've been studying the program for almost 20 years, as long as it's been implemented in many different settings. And we see consistent results, such as consistent significant increases in participant knowledge, preparedness to respond, and a decrease in stigma, which is the scale at the bottom, which indicates that people are much more likely to step up and take action and are less likely to let stigma or concerns about mental health or other kinds of issues or dynamics get in the way of them helping somebody. When we do youth trainings, one of the common responses we get from youth before we do the training is that if they were to look to somebody for help, it would likely be a friend or a peer. And then at the end of the training, it's unanimous that youth would turn to an adult for help. And that's really the result that we want. But we know that when we train youth, we want to make sure that we train the adults first, so that when those youth turn to an adult for help, they're turning to an adult who's been trained and is prepared and ready to respond. So we do this in a sort of this incremental kind of way, rolling out the adult trainings first and then moving on to the youth trainings. I just want to back up for a moment to some of the qualitative responses results that we've gotten are people reporting increased knowledge and confidence, people indicating that they feel much less stigma around suicide and mental illness, more comfort in talking about it, more confidence in taking action. We've seen systems like schools implement evidence-based practices across the board. We've heard and been witness to life-saving interventions that have resulted directly from people who have received the training. We see greater integration and communication within systems and across systems, and then comprehensive plans and ability to respond to crisis or traumatic incidents have resulted with the work that we've done with schools and communities. And we see communities and schools mentoring each other. And we also see people becoming much more empowered, especially youth who become leaders and champions in suicide prevention and postvention. And we've also seen increased and expedited access to resources and supports for those who are at risk for suicide or those affected by a suicide death. So we have a number of schools that have given testimony, and there's a video clip that we will make available to you, and we'd love to have you view it. But here's some of the comments that came from some of the people in this community where we worked. And clearly from the school personnel point of view, they felt like they were much better prepared, but also the students noticed that too. The students said, yes, now the teachers know how to handle these situations. And in one case, in many cases, the schools have the students not only train their peers, but they actually have them train the teachers. And the students in one school were telling us that they were training the cafeteria staff, and the cafeteria staff thanked the students and said, we really need to know about this because we hear students say things all the time and we don't know what to do with it. And the students who were training them said, yes, we want you to know what to do, because when we walk through that lunch line and we come into contact with you, we have our guard down and we say all kinds of things that we might not say in front of other members of the school community. So they really saw it as a way to make sure that there were no gaps and there were people at every point in that student's life and in that student's day who would know what to do. And then the student on the right was talking about the impact that they had in their school of losing classmates to suicide. And his closing line was very poignant. He just said, every teacher, every person that we train has the potential to save a life. So I just wanted to let you know that NAMI New Hampshire, again, has been here in New Hampshire for 40 years. We have many services that are available throughout the state. In addition to our suicide prevention program, we have a full children's and youth services that provides one-on-one and outreach to family members. We have support groups, we have classes, we have we're involved with the Fast Forward program, and we have online support and networking, and that's available for parents and families throughout New Hampshire, as well as families of adults. But particular to schools, there is a children and youth services program that is quite comprehensive. We also know that when schools and communities and families are impacted by the loss of suicide and a tragedy like a young person who dies by suicide, that NAMI can be there. We can provide one-on-one support to the families, to the individuals, to the students. We can provide some group support. We can help guide a school through the protocols and communications and different kinds of things that need to be dealt with in the aftermath of a suicide. We can help with media. We can help with social media. We can help with the longer term issues that may come up, such as watching for contagion, dealing with memorial activities, anniversaries, things like that. So do know that we are here and available in any time that might be needed. And then if you wanted to just look at what's happening across the state, the Connect program website has annual reports, keeps our state plan. There's a lot of really good data there, talks about different initiatives going on in New Hampshire. And there's a whole section on resources for people who've been impacted by suicide. And then we have training and speakers bureaus with people with lived experience who can speak to communities, schools, and other organizations around mental health and suicide prevention. And they're incredibly inspiring people who share their stories in a way that gives hope, inspiration, and allows others to seek help as well. So here's the Connect team, the primary folks that are working and doing the training. You probably recognize some of us. Many of us have been around for decades in New Hampshire, working with schools and working with communities, doing suicide prevention, postvention, and consultation to many of the communities around New Hampshire. So we invite you to reach out to any of us at any time through NAMI New Hampshire and let us help you in any way that we can. We clearly feel that suicide prevention and postvention is really, it's not up to a school solely. Schools play a really important role in the lives of their students, but the suicide prevention and postvention work that we do, like many other areas of work that we do to keep our youth healthy and safe, really is up to all of us. And so feel free to stay in touch. If you want to know more about the program, you can get in touch with me. If you want to get some testimony or be referred to people who have implemented the suicide prevention, the Connect program, I can steer you that way. And I can also provide you with a list of trainers that may be in your region and might help you to roll out the program. Thank you for this opportunity.